In this next segment, we're going to be talking about something I think a lot of people can identify with, back pain. We're here at Augusta Health's Spine Center with Dr. Matthew Pollard. Dr. Pollard, tell us about your specialty.
Well, my specialty is spinal surgery, and I'm a board-certified, fellowship-trained spine surgeon. And with that training, we learn to treat all manner of spine problems and disorders, some of it with surgery, much of it without surgery. We also send people for injections and physical therapy, really whatever it takes to give them the relief they're looking for.
What are some of the most common complaints that people come to you with?
Probably the most common complaint is back pain. Another common complaint is sciatica or disc herniations, and that can occur in the neck or in the lower back, causing arm pain or leg pain.
And is this usually due to someone injuring their back, or maybe they've been out doing yard work, or do you find that over time there are issues that have caused the pain?
It's usually a combination of all those factors. Sometimes there is an acute injury, oftentimes it's genetic, oftentimes it's age-related, or again a combination of those things.
So if I come to you and I'm, say, suffering from lower back pain, how do you go about the diagnostic process, and what can a patient expect?
Well, we start with the history and the exam, which are two of the most important things, because knowing more about the pain, where it is, how it affects someone's life is very important. Oftentimes we will get imaging studies such as x-rays or an MRI scan, and those will provide helpful information as to whether we're dealing with a disc herniation or sometimes even spinal instability, and the treatments for each of those is different.
And I'm sure it varies greatly from patient to patient, but are there certain indicators of when probably surgery as opposed to various therapy alternatives are likely going to be involved?
Occasionally we find someone that needs to have urgent or emergent surgery, but most of the time what we do is elective. And so we usually try a course of treatment, and if it's clear that the conservative treatments are working, that's all that's needed. But quite oftentimes those don't work, and we do have to go to surgery, which would be the next step for some patients.
Dr. Pollard, tell us a little bit about the different kinds of surgeries you do, from the minimally invasive to major surgery, and what the recuperation periods are.
Sure. So with new surgical techniques, we often can do what most people call minimally invasive surgery, which is smaller incisions and quicker recovery times. And we can do that for major surgeries or minor surgeries. It just depends on the particular situation. We also do a lot of cervical spine surgery, which is neck surgery for disc herniations in the neck, again to treat radiating arm pain. We also will treat a lot of people with a procedure called kyphoplasty, so that's the elderly people with compression fractures, and that's an amazing recovery that people get. So we have a lot of different techniques and tools now that we can use to give people the relief that they're looking for.
And I'm certain, I was actually just reading the next issue of Augusta Health's articles that will include you and a patient of yours, and a patient by the name of Danny Bowers said, "Dr. Pollard and Augusta Health gave me my life back." Talk a little bit about what it feels like to be able to bring somebody through a treatment process and then be restored to complete health.
Well, some patients are just really at their wits' end. They've got terrible pain, they've tried everything short of surgery, and they're really quite desperate, and the pain can be excruciating. And this was a patient who actually came in from West Virginia to see us, and we were able to move him along pretty rapidly to get relief. So after 4 months of severe pain, we gave him almost instantaneous relief with a minimally invasive operation. So it's a very gratifying part of the job to find people that we can help like that.
And obviously, or maybe not so obviously, you are an orthopedist. Mm-hmm. Tell me about the spine specialty. How did you come to just focusing on the spine?
So as we're training, we're exposed to all types of surgical treatments and treatments in different parts of the body. And as people get interested in different areas, they gravitate towards one or the other. And so the field of spine surgery is very subspecialized and very unique in many ways, and usually requires a fellowship, which is an extra year of training, just to learn more about it. So the diagnosis is different, the treatments are different. all those things are have to go into the mix.
Well, I'm certain all of the people out there who have suffered with some sort of back pain are glad to know you got that specialized training. Thank you very much.
Thank you.